Okay, recording.
So so everybody is muted, right? Are we good, Susan?
Yes, I muted myself, so yes.
Okay. That's okay. We're good to go, right?
Yes.
Okay. Good afternoon, everybody. My name is George Yakubian. I'm the founder and executive board chairman of the Society for Orphaned Armenian Relief. Joining me here this afternoon is our executive director, Haripsime Muradian. She is in Armenia, based in Gumri. She oversees all of our operations in Armenia, in Artsakh, Java, and Lebanon. The title of our presentation is A Systems Approach to Child Care Protection in Armenia. We're going to talk for maybe 30 or 40 minutes, and then we'll open it up for questions at the end. So we're going to try to cover 4 specific topic areas today. We're going to talk about child protection generally in Armenia. Haripsime will talk about the COVID and Artsakh situations, and then I will present results from our human rights study that we conducted earlier this year in Armenia. So generally, child protection in Armenia, and I have this conversation when we bring on new chapter members or new board members when they ask us, kind of, what do we do in Armenia? What populations do we provide services to? Our mission very broadly is to provide humanitarian assistance to orphaned Armenian children. When we first started SOAR back in 2005, we had a very specific and limited population. We assisted orphanages in Armenia. Over the years, our mission has evolved, and so has the population that we offer assistance to in Armenia. Today, we cover a range of childcare alternatives. We refer to it as the childcare spectrum in Armenia. And what we mean by that is that we provide assistance beginning with the day centers in Armenia. These are non-residential facilities. They are working with families whose children are at risk for institutionalization. They could be suffering from poverty. There could be other social problems like domestic violence, alcoholism, etc., the same sort of problems that you see here in the United States and elsewhere. But these are non-residential 9 to 5 facilities, and they're working with the families. We are providing support to the institutions themselves and to the families by way of financial support to help address whatever the issues or problems are that are making their children at risk for institutionalization. In the middle of this child care protection spectrum are the residential care facilities that we support. In Armenia, we support primarily orphanages and several boarding schools. As a practical matter, these are children who needed to be taken out of their home for one reason or another. The difference between orphanages and the special boarding schools is relatively minor, but these are full-time residential care facilities where the children are living in these facilities, and if they are healthy children going to school in the community with respect to the orphanages, with respect to the special boarding schools, attending school in-house. At the back end of the child protection spectrum is our work with deinstitutionalization and reunification. We work with the facilities to identify those kids who may be eligible for reunification with their families. The decision is normally made by the institution. If there is a particular child that is eligible to return home, we provide assistance to the facility, to the family, to the child. We get that child home and are typically working with the family for a year, sometimes 2, to make sure that the children do not have to be reinstitutionalized. And the last facility that I'm going to mention, which again is unique, it falls at the far right end of our child protection spectrum is SOAR's Transitional Center. We opened our Transitional Center in Gyumri in December of 2019. It is a residential center for older teenage girls who have outgrown the traditional orphanage. So over the course of the last 15 years, even though the age of 18 is the age of majority in Armenia, we have not used that as a strict guideline for providing the assistance that we provide. There are girls who will graduate high school or graduate one of the orphanages, and many are not ready to be living on their own. The teenage boys usually go straight into the Army. There's compulsory 2-year military attendance after the boys turn 18, but sometimes the girls have no place to go. So at our transitional center, the deal is that they come, they will hopefully commit to us for 4 or 5 years. We provide room and board, tuition for a higher education. We get them involved with our SOAR academic programs that are run primarily by our chapters in Europe and Asia. And we are in the process now of cultivating a business that will hopefully, again, generate funds for the girls, generate funds for the center. And ultimately, after 4 or 5 years, the girls are graduating with at least an undergraduate degree, perhaps a master's degree, and are ready to move on to independent living. That's the range of child protection alternative, residential and non-residential facilities that we support in Armenia. Okay, the COVID situation I'm going to turn over to Hadipsimed to talk about.
Okay, good evening from Armenia, everybody. Thank you for attending our webinar. I am Hadipsimed Muradian, the Executive Director of SOAR in Armenia, and I will try to present situation within COVID-19 and a picture regarding to our child care and protection facilities. As of October 24th, generally in Armenia, we have 75,523 confirmed cases of COVID-19 within its borders, with 50,701 confirmed recoveries and 1,157 confirmed deaths. And Armenia reported its first COVID-19 on March 1st, 2020. Just the very beginning day of the spring, not a very happy start with the spring. And after the spread of COVID-19, tight restrictions were introduced and a full lockdown was imposed in April. Orphanages, boarding schools, and special care facilities were also locked down. Most boarding facilities sent the kids back to their biological families, but some of the kids had to stay in the facilities because of poor conditions at homes, or they just don't have any home to go. Coronavirus cases have been reported in May and late in May, in June, and in July in some of the few child care institutions that we have been cooperated with, like Nassim Boarding School in Gyumri, Children Home of Gyumri, Marie Izmiryan Special Orphanage in Yerevan, Zorai Care Center for People with Mental Disorders. And infected patients and children were immediately isolated, and doctors worked at the institutions. The area has been disinfected, and thus prevention work has been carefully carried out. In addition to all this, we tried to provide diapers, masks, hygiene supplies to those institutions to take proper care of the kids and support facilities, thanks to Project Cure shipments that we have received. And to reduce the likelihood of COVID transmission at child care institutions, shift work has been set up, and this will continue to be used through December 31 until the end of this year. I would like also to mention about the situation at daycare facilities, because in daycare facilities, the professional work, social and psychological consulting, individual trainings were conducted online by the specialist as far as it was possible to do. But the following problems appeared from the very beginning, because most of the kids have no resources at homes. They have no computers, no wireless networks to participate in this distance learning that was organized recognized in Armenia. So the same also goes for teachers. The Ministry of Education tried to find a quick solution to the problem by initiating the recruitment of computers and then providing them to these groups. However, there were still, and they are still, thousands of children and teachers who do not have access to computers and the internet. Classes were broadcast on public and regional TV channels. The second issue that I would like to mention arose immediately with the onset of distance learning was the need for professional support for children with special educational needs. They are not provided with necessary technologies such as audiobooks for visually impaired children or sign language translation for hearing impaired children. Unfortunately, television lessons were initially filmed without sign language, and the emphasis was on speed, and priority was given for providing access for larger groups. However, within time, some lessons have become available in Armenian sign languages as well. Given the unemployment created by the COVID situation, workers typically paid daily at their jobs, and you know that food and proper hygiene for their children. So SOAR commenced an immediate response to help the families of daycare institutions. I would like particularly to mention about the assistance that we provided to beneficiary families of Our Lady of Armenia centers in Gyumri and in Tashir. It is very well to mention that the beneficiary families of these centers, they are located in different regions, marzis, villages of Armenia, and we could, with the help of sisters and also with the help of our transitional girls, we could distribute food packages to these families twice per month in July and August, and we could reach to more than 70 families and distribute food packages. We also tried to help and reach to 65 families from Oran Daycare Center, which is located in Vanadzor, and we helped also those families, those children who are attending to Oran Daycare Center. And as well, we helped our GSCC Social Child Care Center, which is a state-run child care center, and it is located in Gyumri. And we have 13 beneficiary families there that we are providing that they are in our sponsorship program, and we try to reach to these families, and we provide them also with food, with necessary items, and whatever was needed within this COVID situation. So I think this much about COVID that I can present, relevant our works and activities and overall situation with child care institutions.
Okay, thanks. I'll move to the next slide.
Okay, the next slide is Artsakh, right?
Yes.
So on September 27, 2020, Azerbaijan launched indiscriminate airstrikes and artillery assaults against the Republic of Artsakh. Azerbaijan has consistently violated customary international humanitarian law by targeting civilians, including children, residential areas, civil infrastructure, public and industrial facilities, churches, cultural centers, and hospitals. In Artsakh, we have been cooperating with two boarding schools. One boarding school is located in Stepanakert, and the other boarding school is located in the city Berdzor. As far as it was possible, I just tried to get information about the status and situation of these boarding schools, and I had a phone conversation with the director of Stepanakert boarding school today. She is in Yerevan. They were able to take children from boarding facility and to move to Yerevan, and we have there is a SOS Kotaik villages in the premises of Yerevan, not very far from Yerevan, where these kids and some of the families and their staff members have been hosted. So SOS now is providing shelter to 39 displaced children and 16 adults from Artsakh, from which 22 children and 6 adult staff members are from Stepanakert boarding schools. So I tried to reach to SOS and ask about the needs of the children and families sheltered there, and we have been presented with a list of the needs which starts from mental health and psychosocial support, neuro specialists, art therapy specialists, some basic items, clothes for seasonal clothes, some including stationaries for education for the children to go back up to go for classes, supplies for access to distance education, and different kind of needs that we have been presented by the SOS that currently these children are in need. And we also try to support for medical interventions, because some of them, these kids, they have disabilities and now they need also medical interventions. As a result of the hostilities, there is an information that more than 24,000 children from Artsakh Republic were deprived of the opportunity to perform their right to education. The buildings, more than 10 schools, as well as a number of kindergartens were damaged. Due to my phone conversation with Stepanakert directors, boarding school director, today she mentioned that the building of Stepanakert boarding school has not been damaged very much, just the windows, the parts of the windows of the building, but there is no information still from another second boarding school which has been located in Kashatakh, and we know that the airstrikes there are very heavy, and we hope to get information from them very soon. Regarding to Artsakh project, I would like to mention that early in March 2020, so SOAR has founded Families of Fallen Soldiers Relief Fund and service personnel by providing emotional, educational, and financial support and children's enrichment assistance. The fund aims to build strong, caring, and loving bonds with each family and to follow the widows and children through the years to assure that no children of fallen Armenian soldiers are ever institutionalized. We are trying now to make the list of the families, fallen soldiers, where they have minor children, 2 or more minor children, and we will try to reach to these families to make proper need assessments and try to help with the needs of the children. So any questions, please?
Thanks, Edipsime. I'm going to move on to the human rights study that we did, and then we can just save questions on all of the topics at the end. So we started our human rights study really a couple of years ago. My background is international human rights law, and just very briefly, there are really 2 instruments that guide the treatment of children at residential care facilities. The Convention on the Rights of the Child is an international instrument to which Armenia is a party. It was ratified in 1989. There are several articles within the CRC that talk about institutions and the responsibility of care for children within institutions when biological families are either unable or unwilling to raise the children in their home. The second instrument is the guidelines for the alternative care of children. This is it's not its own convention. It is an enhancement to the CRC, and again, provides some guidelines as to how to care for children when they are not able to be raised within a biological household. The guidelines talk about a spectrum of child care options, and these alternatives are presented in the guidelines intentionally hierarchically, beginning with biological parents. Kinship care is the care of children with non-parent biological family, foster care, family-based institutional care, which is like SOS children's villages that Edipsime just talked about, large residential facilities, which are the traditional orphanages and special boarding schools in Armenia, and finally adoption. Armenia has all of these options that are articulated in the guidelines. Very briefly, a modern history of Armenia. I'm just going to point out the genocide from 1915, the earthquake from 1988, independence from the Soviet Union in 1991. I have this slide here just to demonstrate that there have been several cataclysmic events over the course of the last century that are important to understand in the context of realizing the significance of orphanages and other residential child care institutions to the Armenian culture. The genocide, of course, displaced thousands of families and children in Armenia and to other parts of the Middle East. The earthquake, of course, created orphan children as well. The independence from the Soviet Union in and of itself did not create orphan populations, but again, thinking in terms of a country starting over only 30 years ago, and the importance of having these residential childcare institutions to be able to provide support to families when the families just were unable for one social reason or another to fulfill their family obligations. SOAR, we've been working in Armenia since 2005. I talked about our target population, and our work spans the entire child protection spectrum. I think most importantly, when I talk to people about what does SOAR do in Armenia for the children, the answer is we try to provide to institutionalized children everything that they would get if they were living in their own homes. So the work that we do covers everything from basic humanitarian support, new food, new clothes, and evolves to facility level improvements, renovated bathrooms, classrooms, bedrooms, new sheets, towels, etc., to larger projects such as renovating physical therapy suites, gymnasiums, constructing soccer fields, to more aggregate and systems level improvements throughout Armenia, including, for example, a free dental clinic, which we have in Gyumri, a mobile eye care clinic, which we launched just a month or so ago. These are two projects that provide dental services and eye care services free of charge, not just to the orphan children that we support, but to other populations as well. And of course, our transitional center is new and provides support to the older teenage girl population I talked about before. Table 1 is a summary of Armenia's residential child care institutions. You can see that they are disaggregated by various categories. There are state and private facilities, children under the age of 6 and over, and then children that are healthy and special needs. 23 altogether, including 4 transitional centers, one of which is ours. We put together this study. It probably was in the works for a couple of years before we really moved into developing a methodology last year. One of the first things that we did was, of course, look to see had there been any research done with children in orphanages and special boarding schools. The answer was virtually none. The one or two studies that had been done before were methodologically flawed. So we wanted to put together a study that would capture this idea of child protection and children's rights, to assess the extent to which the facilities are adhering to their responsibilities under the Convention of the Rights of the Child and the guidelines. The children living in RCI, and RCI is an acronym that stands for Residential Child Care Institutions. RCF is Residential Child Care Facilities. Those are synonyms. They are typically referred to as hidden populations because historically they are difficult to access for a lot of different reasons. And so one of the goals of this study, one of the principal goals, was to assess from the beginning, were we able to even access these populations to conduct the substantive research that we were interested in conducting. This was a multi-method empirical study, really 4 separate parts. The first, we collected empirical data in the early part of this year, January through May, to explore factors associated with institutionalization and reunification. And when I say official data, I'm talking about official records from the facilities in which we collected the information, data on the children, where they came from. The second part of the study was a self-report survey component where we asked questions of children at 15 facilities and explored the constructs of abuse and neglect, access to education, personal hygiene, and sexual abuse. Third, we had a qualitative component where we used observational research to investigate food safety and sanitation practices. And finally, facility directors were interviewed on food safety, hygiene, and the facility level children's rights policies. Sampling. There are 23 facilities that we support in Armenia. We did not go into all 23. Some of those facilities have older special needs populations, older or special needs populations exclusively. Ultimately, we decided to approach 15 institutions, again, because of the personal characteristics of the children. I'll show you table 2 in a second. These 15 included 12 orphanages and 3 special boarding schools. Only children between the ages of 10 and 17 were included in the child survey, again, because we were operating under the assumption that children under the age of 10, it might be difficult for them to answer questions about serious or sensitive topics. And while the assistance that SOAR provides is not constrained by the age of 18, we did limit our study to children under the age of 18. These are the 15 facilities that we approached for inclusion in our study. You can see that we approached and attempted to obtain official records, complete the staff survey and checklist for all of these 15 facilities. The child survey column, you'll see there are several blank squares there. Those facilities had children with special needs. They could not participate in the child survey, but we did have access, or at least approach them for access for their official record, staff survey, and checklist. So for the purposes of this study, our universe of facilities is the N of 15. Instrumentation, we put together an official records data collection sheet where we collected information about disabilities, dates of institutionalization, family visits, barriers to reunification. The child surveys were constructed to ask questions about abuse and neglect, education, hygiene, and sexual abuse. The staff surveys, again, food safety, hygiene, institutionalization, and reunification. And then our observational research touched on food and nutrition and hygiene. The findings that I'm going to present today, rates of participation, univariate analyses, bivariate analyses, and key findings. Rates of participation, and this was really one of the most important parts of the study. All 15 institutions participated in at least one study component. For the official records, 13 out of the 15 facilities, 87%, granted us access to their official records. The 2 that did not do so for privacy-related reasons. And just as a way of brief background, we did approach both the Ministry of Education and the Ministry of Social and Labor Affairs to get their assent to go into these facilities. They both provided us letters of support. Ultimately, however, it was the facility director that made the final call as to whether or not they were going to grant us access for some or all of these study components. The child survey, one of the rate of participation that I think we're most proud of the 210 children who we asked to participate in the study or who were approached for participation, 98% completed the interview. All 15 of the facilities allowed us in to conduct the qualitative observational research, and all 15 of the directors participated in the staff survey. Some findings from the official records component. We ultimately collected data on 551 children at the 13 facilities that gave us access to the official records. A majority, 56%, were male, 44% female. The average age was approximately 11 years old. More than half of the sample was diagnosed with a developmental, intellectual, and/or physical disability, relatively serious afflictions, CNS disorders, Down syndrome, and autism. Reasons for institutionalization. This was initially an open-ended question that we subsequently recoded into various categories: child disability, poverty, single parent, behavioral problems, abandoned or relinquished parents who were deceased, 2 or more or 3 or more. Nearly 30%, 31% indicated 2 reasons for institutionalization, with 17.5% indicating 3 or more reasons. Findings from the child survey were overall extremely positive across the board on all of the constructs. Of the 205 children who were asked questions about education, abuse and neglect, sexual abuse, nearly all, 93%, reported getting to school on time, going to school every day, receiving help with homework, and 82% were encouraged by facility staff to complete their assignments. Virtually no abuse and neglect or sexual abuse was reported by the children. The 1 or 2 incidents of each that were reported by children against other children. And I can say, without going into details, that these were very, very minor incidents of inappropriate touching. There were no reports of abuse and neglect against staff or directors, and no reports of sexual abuse against staff or directors as well. Hygiene, the compliance again was very strong. Almost all children didn't wear clothes that smelled or shoes that smelled, washed their bodies daily. Almost all took care of their hair, kept their nails trimmed, covered their mouths when they were sneezing or coughing, had enough toilet paper, washed their hands after going to the bathroom, washed their hands before eating. And while a high majority of the children regularly brushed their teeth in the morning, a smaller percentage brushed their teeth before bed. I want to touch on this a little bit because one of the important things to realize here is that when we started SOAR 15 years ago, we were very much interested in cleanliness, renovated bathrooms, making sure the facilities had soap, toilet paper, paper towels, whatever they need to facilitate a hygienic environment. And the facilities know that, and our staff, of course, know in Armenia that this is important to us. This is one of the things that we value the most. And so if a facility is having trouble getting toilet paper, affording enough soap, they come to us and we provide it. We do not want the lack of physical availability of toilet paper, soap, paper towels, etc., to be the reason why the children are not engaging in proper hygienic practices. Childcare alternatives in Armenia. This is, I'm going to kind of summarize everything here, discuss some policy implications. Over the years, SOAR has occasionally been criticized for facilitating residential child care life. Aside from the fact that the criticisms are not only unfounded but insulting, it's important to understand that Armenia is not India or China or Russia or Japan, where there are tens of thousands of children coming into the social system, being taken out of their families. This first box is probably one of the most important takeaways from this study. And it's relatively simple, but there are approximately 1,600 children residing in Armenia's residential childcare institutions. Of course, this number fluctuates year to year, but 1,600 is a fair estimate. Compared to the 3 million residents in Armenia and the 600,000 children who are in Armenia, this means that there is a minuscule population of Armenia's children who are actually residing in residential childcare institutions. So why is this important? This small proportion suggests that, number one, the RCI really do satisfy a critical need for the most vulnerable of Armenian youth. Children are not being pulled out of their homes. Children are not being recruited for institutionalization. These are children who are being taken out of their homes for very serious barriers, very serious issues, primarily safety, primarily physical disabilities. Without the residential childcare institutions that provide residential care for these 16 children, these children would have no place to go. With respect to childcare alternatives in Armenia, there is this spectrum of alternatives, beginning with the traditional two-parent household. Child rearing preferences extend then to a single biological parent, and candidly, most of the children that we support are coming either from single biological mothers or kinship care, where both of the biological parents are not in the picture and the family is being raised typically by a grandmother or an aunt, some other extended biological family. Foster care is not particularly widespread in Armenia. Institutionalization, domestic adoption, and international adoption. This spectrum suggests that keeping children in Armenia may be more important than providing the best long-term childcare environment. Why do I say that? There is a relatively significant literature that talks about international adoptions and how those international adoptions should be moved to the forefront of the child protection spectrum. In Armenia, they really are on the back burner. And again, the idea here is that because Armenia is a relatively small country, there should be attempts to keep those children in Armenia at all costs. Key findings, again, the strong rates of participation. I have done research studies over spanning maybe 25 or 30 years. I have never been involved in a research study where the rates of participation were this high, especially with what we refer to as a hidden population. Why? So the answer to that question is in great part because of the relationship that SOAR has with the institutions and the government of Armenia. If we had attempted to do this study in 2005, we almost certainly would have been denied access. The difference between 2005 and 2020 is that the facilities and the ministries know that we are not just going to be going into these facilities, exposing problems, publishing reports that are either embarrassing or demonstrate malfeasance, and then not coming up with solutions. Several organizations over the years have done that. They come in, they are responsible for human rights monitoring. They may or may not make recommendations, but then they leave the solution to others. That's not how SOAR has operated over the course of the last 15 years. If we see a problem and we are able to correct it, we do so. We took the same approach with this study. We told our researchers and our staff in Armenia, if you're doing a qualitative observational research study and you stumble across a refrigerator that is not cooling properly, tell us and we'll replace the refrigerator. So these strong rates of participation are in great part because the facility directors and the ministries knew that we were coming in with the intention to help and not expose. The ease with which human rights constructs could be operationalized. I worked last year about developing these instruments and pulling from other instruments that collected information on these topics. The surveys were very well received, and the answers reliable and valid. Another key finding: children are relinquished because their home situations are severely compromised by multiple social, environmental, and physical obstacles. Again, this is important to understand when someone comes to us and says, George, we think all orphanages should be closed in Armenia. That is a very simplistic suggestion to a very complicated problem. It is not just because there happens to be some poor families in Armenia that parents are relinquishing their children. Almost all of these children have severe multiple social, environmental, physical problems, and like I showed earlier, in many cases 2 or more and 3 or more, that make it very, very difficult, if not impossible, for the child to remain in their home at that time. The last key finding: strong human rights compliance within the RCI across all of the constructs that we investigated. Policy recommendations in future research. We did not address whether children in residential care perceive their institutions as familial environments. This is an interesting question because the biggest criticism of residential childcare institutions going back decades is, of course, that children will not get the emotional love and support that they would presumably get if they were being raised in a biological household. The challenge, of course, for SOAR as a humanitarian organization, for us as researchers trying to investigate human rights compliance, is assessing the extent to which these children might actually get love and support from their facility directors, facility staff, and other children who are there. The challenge, of course, the challenge is trying to find a balance between love and support in a familial environment and that child being able to be raised in a way where he or she will eventually grow up into a self-serving, independent adult. And we believe that the facilities with SOAR's support have the opportunity to serve as exceptional surrogate caregivers for the children when they are taken out of their home. And we hope, of course, that the current study can serve as a model for replication in countries where RCI are more abundant: China, Ethiopia, and Russia. More policy recommendations: rather than reflexively advocating for closing RCI, decision makers should weigh the consequences of care with biological parents against all alternative child rearing environments. SOAR does not favor taking children out of their homes. We're not involved in those decisions at all. We are simply involved with assuring that once children are taken out of their homes and living in an RCI, that they have all the advantages that they would otherwise have. The international community generally, and Armenians specifically, should encourage domestic and international adoption as an alternative care to biological parents. Toward that end, facility directors in Armenia should terminate parental rights when reunification is unlikely or impossible. Finally, a SOAR's commitment to child protection exhibits an underlying compassion for every child that is abandoned, abused, or forgotten. And we have believed for 15 years, and the current study provides even more support for our position that these residential child care facilities should not be vilified as the last resort of child care. Instead, they can serve and do serve as optimal surrogates for biological parents who are either unwilling or unable to offer a familial environment that is free of apathy, discord, poverty, and misfortune. So that is, thank you everybody. That is our presentation, and we're just right around 45 minutes, which is good. So we have about 15 minutes for questions and answers. And does anybody, Susan, if you want to unmute everybody.
They can, I set it so everybody can unmute their own when
Okay, good.
they want to talk, so yeah.
Okay, great. So does anybody have any questions or suggestions?
George, this is Rafi.
Hey, Ralph.
Maybe I missed it, but are we anticipating obviously more orphans due to the conflict right now?
So I think the answer to that question is probably, although it's certainly unknown. Haripsime did talk about the displacement of the children at the Stepanakert boarding school to Armenia. They're being housed at SOS children's villages right now. Whether they are ultimately able to go back, I think, is an unknown at this point. What do you think, Haripsime?
In addition what you have just said, George, I would like to tell that from a conversation with Stepanakert boarding school director, she mentioned that some of the children from boarding school were able to go back to their biological families and move to Yerevan, and now they are living in different places. Actually, in Yerevan now they are different districts, like in Nubarashen, in Kodaik, that families and children were somehow hosted and they live there. And we hope that whatever we are considering, any plans, any projects for children who have been moved from Stepanakert and now in Yerevan, we should consider at least within 3 months period staying in Armenia, in Yerevan, because you know that for very simple reasons, most of the Stepanakert have been destroyed, and winter is coming. So most obviously, when everything will be over, the war will be over. So after 3 months minimum, after 3 months, so we could say when they can go back to their homes, to their schools. And at this moment, Rafi, unfortunately, we don't also have any data about orphans. We know that there are many families that they lost their fathers, these kids, that they have one or they have more than 2 children, minor children, but for different reasons, this information still is kept in privacy. So that's why we don't have access to this data yet, but we will try to allocate all these data when it will be possible, just for us also to understand how many families we will be able to provide assistance within our Families of Fallen Soldiers Relief Fund.
And I was going to comment on that too, Raf, that the Fallen Soldiers Fund, which we started in the spring, I mean, the intention of it, of course, is to make sure that children of soldiers killed in action don't have to be institutionalized. So the hope is that we'll be working directly with the surviving spouses, whether it's one children or multiple children. The idea is to provide them whatever financial and emotional support they might need to make sure that their children don't have to be institutionalized.
Yes.
Right. Okay, great. Thanks.
Any other questions or comments? Okay, the last thing I will mention to everybody, if nobody has any more questions, is that we just finished the final report for this human rights study. Susan, if you don't mind, at the end, maybe you can just send the link to everybody on our website. So if they want to download the PDF, they can go right to it. It gives a more detailed description of our study methodology, our findings, policy recommendations, et cetera. This was just an abridged version of what the final report actually documented. And our hope is that this human rights study is going to continue year in and year out. We're going to be doing a follow-up study sometime in the spring of 2021, and I am hoping that we will do a longitudinal study either starting next year or perhaps 2022, depending upon the COVID situation, and tracking cohorts of children over time to look at the long-term impact of residential child care life compared to other family-based and child care alternative options. Well, thank you, everybody. If nobody has any more questions, we'll close the webinar here. Our hope is to probably do this again at some point, at least once a year. So maybe we'll do it again sometime in 2021 when we have an update of the second round of our human rights study. Thank you for attending, everybody.
Thank you.
Bye-bye.
Thank you. Bye.
Bye.
Hold on, I'm sending
Thanks,
the link to
bye.
the human rights page right now so that everybody can, you can go there and then download the human rights study.
Thanks, Susan.
Yep. Okay. Okay.
Mm-hmm.
Okay. Everyone see the link, right?
All right, thank you, bye.
Thank you.
Thank you, everyone. I'll leave it open until I see everyone has what they need.